All right, so we have to look at, since we did look at that Nstemi, we have to look at the other presentations of acute coronary syndrome. And those presentations, again, $4 words, you know, kind of language we don't talk every day. Confusing sometimes, depending on if you're looking at what you're looking at. Nstemi was our ST elevated MI. We already talked about that. We talked about a regular heart attack being the ST elevated MI. So we're going to erase some of these terms so you feel like you're accomplishing something. How about that? However, we're still talking about acute coronary syndrome, but we're talking about the Nstemi. So the Nstemi presents as either unstable angina or just an Nstemi, not really specified. Here's what I mean by that. You heard me say with acute coronary syndrome, the patient is symptomatic. They have chest pain, they have the jaw pain, they have the shoulder. And I want to point out a couple things that sometimes we miss because the patient is a diabetic or the patient is female. Remember, females are very different from men. They may not present with the same classic symptoms as a man does. I remember one of the popular celebrities, she had a heart attack and she had no idea she had a heart attack. In fact, she worked all day with her heart attack. I've heard patients say they worked all day. I've seen students talk about they had a heart attack and they stayed at work in 12 hours in nursing. For 12 hours now. So women are very different. I'd like to say that for women, sometimes we go through so much every day, all day, and we constantly trying to do stuff. I just put it out there for you, okay? You know, you wake up and Bebe and Shay Shay got to get to school and Nene done got suspended, so you got to worry about what to do with her. And then you got to make sure when you get up that somebody eats something, so you're running all over trying to get some food. Then you drop them off at school. You're running late to work. You get to work by the nick of time. There's some BS going on at the job. Somebody called off, somebody's sick, whatever's going on. You got to work short staff all through here without lunch. Then after that, you got to worry about what mama gonna eat. Got to get a dinner going for mama. Got to get to flavor of the month. You know, that man you messing around with. Got to make sure he gets some attention and eat something for that day. And I mean, you're just doing so much. And then after you're all done with that, you still got to go to school. Because yeah, you go to school in the evening. You're trying to get your degree. You got to get the BSc, and then you got to get the MSc, and then you got to get the PhD. I'm just saying, you're doing too much. And then you're trying to look cute. So your hairdo got to fit in, your nail appointment got to squeeze in. You're doing all this stuff. And oh, you got to do the laundry, and you got to cook. You got to do, the house got to be clean, the yard, and now we're cutting our own grass. I mean, it's just crazy. I'm just saying. So women can go and do all this crazy stuff and not even realize that they're having a heart attack. The symptoms are mild, or they're having some acute coronary syndrome, because we got to use the right language. They may just have nothing but a backache. They may just wake up nauseous. They may be just extremely tired. I had the one girl say, I was sweating and I was tired, and because I took your class, I understood the sweating was a medical emergency, and I thought about it. I said, oh my God, I got to go to the ER. And she did, and she was having a heart attack. So it could be any of those. Diabetics, after so many years of being a diabetic, their nerves are shot to hell. They don't feel the way they felt 20 years ago. The feeling of what a heart attack feels like does not present in many diabetics. So think outside the box, okay? So, you know, be ready to do an EKG at the drop of a hat, right? Okay, so let's carry on. We got this acute coronary syndrome. We have a patient coming in that we based on the EKG. There's no ST elevation. And we have to wonder why, right? We have to be smart about that. Well, there's something called ischemia, which is decreased oxygen in blood to tissue, but not death to tissue. There's something called an infarct or necrosis, and that obviously is death to tissue. Myocardial infarction, death to the muscle of the heart. Okay, so death to tissue is an infarct or necrosis. When we have angina, we're having ischemia. Yeah, I know, it's a $4 word, but you gotta know it. You know you gotta know it. I-S-C-H-E-M-I-A, ischemia. Lack of oxygen to tissue, including in the blood flow, right? So when there is angina, you have to separate it in your mind to remember there could be a patient presenting with acute coronary syndrome from unstable angina. Now let's think about that. Stable would need to be defined before I sit up here and talk about unstable. Stable angina, predictable, happens during activity. I can point to a trigger: cold weather, big meal, sex, exertion, smoked a cigarette, fight with your man, all that triggers. This is unstable angina. It's not stable. Stable angina will stop when you rest. Stable angina will respond to medications. No, this is unstable. Excuse me, honey, I don't know where that's from. Unstable angina is going to continue whether you rest or not. Unstable angina is not going to respond to nitro or any other medication. Unstable angina is going to get worse and more frequent. Unstable angina will lead to a heart attack within 30 days or so. It's a precursor or warning. Hello, red lights. I'm going to stop on you one day and just can't function. So this patient is very important. And initially they all look alike, right? So we did our aspirin, we did our EKG, and now what do? Well, we're not going to do a cardiac cath on that patient unless there's some instability in the patient and things are just getting worse before our eyes. Typically, we can schedule a stress test for the patient within that time frame. We're not letting them out of the hospital necessarily, but we can get a stress test ordered for this patient to figure out what's going on with this patient. But the bottom line is, it is an example of another acute coronary syndrome. Now, sometimes we have a non-ST elevated MI that is nothing to do with unstable angina, and instead is a patient who has positive troponin, so there is damage to the muscle. Because remember what troponins are. They're a protein that reflect damage to cardiac muscle. They're very specific about that. It's not your muscle in your arm. No, troponins is cardiac muscle. And they're not found in your patients normally. So it's not cool to be walking around with positive troponins, okay? It is reflective of heart damage. So if the patient does not have the Nstemi, if the patient does not have the ST elevation, we call it a non-ST elevated MI. And this patient is going to literally need to go and get managed very much like a patient with an MI. Because again, they're warning you something really bad is going on. Okay? So stay focused. We'll be back.